David Roberts.
Katrina Roberts.
Jaden.
Okay, today we're going to be talking about introduction to hemorrhage control. As someone who works in EMS, lives are often on the line anytime that I show up to a scene. Bystanders, they're often caught waiting for EMS to arrive, which can waste precious seconds when seconds count. So when somebody's bleeding out, oftentimes you only have seconds to control that bleed, because from a major artery or major vessel, you can bleed out in minutes. So that is why today we're going to talk about hemorrhage control. It's a big killer, both in the battlefield and during most traumas. That's one of the #1 killers. It's critical for all people to understand, whether you have a medical background or not. Oftentimes bystanders are the first responders because they're the first ones there. Just a disclaimer, this does not cover everything, so this does not take the place of a real stop the bleed course or trauma course. We're going to cover today types of bleeding, steps to hemorrhage control, and special equipment that you might run into. So the major types of bleeding, you have arterial bleeds, venous bleeding, and capillary bleeding. We'll start with capillary bleeding. That's the least life-threatening. That can be anywhere from a paper cut to, a smaller cut that can usually be controlled with just direct pressure for a couple minutes, and it will stop. You can put a Band-Aid on it, typically. Venous bleeding, it's usually steady, the steady flow. It's dark red in color. Direct pressure can also stop this. It can become life-threatening if it's not managed. You do have some major veins, like your jugular vein. There's not as much pressure in those veins though, so it still bleeds a lot, but it's not going to bleed as much as one of your major arteries, like your carotid artery or your femoral artery. So that leads us to arterial. Your arterial bleeds, that's usually bright red spurting blood. So you can't really miss it. It's just going to be squirting out of the arm or leg, typically, because there's so much pressure within those vessels. That's why it spurts out. It often pulsates as well. So now we're going to go over the steps to hemorrhage control. Your first step, call 911. There's only so much that you can do, so you want to get those paramedics, EMTs, you want to get them there as quickly as possible. Once you call 911, or as you're calling 911, you can put them on speakerphone. You want to, if you don't have any supplies, you want to apply direct pressure to that wound. So you can use 2 hands. If you can't go hands-free, you can use a knee, an elbow, anything that you can get a good amount of pressure on there. If you do have a trauma kit, such as something like this that might have a tourniquet, it might have a Israeli bandage, that's some stuff that we'll go over. You can use that equipment. So we'll start with extremity bleeds. These are typically arterial bleeds, so that spurting bleed. You'll use something like a tourniquet if you have one. So a tourniquet basically is something that can hold that pressure there and cut off that blood supply. So I'm going to show everybody really quick how to apply a tourniquet. Again, this is just a quick rundown, so you got to practice. I'm going to use a water bottle here for demonstration. So you're going to apply it. You want to apply it high and tight. You're going to strap down and pull as hard as you can, and you're going to wrap it around, Velcro it. You're going to twist this windlass, and once you twist it about 2 to 3 times, you're going to clip it into this windlass holder. This is a water bottle. It's a little thick, so it's not going to turn all the way. And then after that, you're going to secure the Velcro directly over. If there's a timestamp right here, you're going to write that time on there. You want to make sure that you continue to tighten until the bleeding stops, because if the bleeding doesn't stop, the tourniquet doesn't work. So then we'll go on to junctional wounds. Junctional wounds are things in the neck, shoulder, groin area. Those can't be controlled with a tourniquet. Never apply a tourniquet to a neck, to a joint like a shoulder or a knee. Obviously, if you applied it to the neck, you're cutting off vital blood supply to the brain. And if you do it to a joint, it's not going to work correctly. So that's why you have you wound pack. So I'm not going to go over all the basics of wound packing right now, because there's just a lot of things that you can go over. But there's hemostatic gauzes, which it looks something like this. I have one right here as well. Let me see. They come in little packets like this. It's basically you take it and you would stuff it into the wound. We won't go over the technique right now, but it has a special agent in there that helps the blood to clot, and then you would apply direct pressure to stop that bleeding. Some other special equipment that we're going to go over, there's Israeli bandages. They look something like this. These are like pressure bandages, so something that you wouldn't need a tourniquet for. So if it's not an arterial bleed, you don't need a tourniquet. You could use something like this. This will hold the pressure for you. We also have chest seals. Those are something that you would put over somebody if they have a chest wound. You would put that over the opening in the exit wound to prevent things such as a tension pneumothorax, which is also another life-threatening issue. Lastly, we already went over tourniquets, so that's about all of the special equipment that we're going to cover right now. So just to wrap up, you can save lives if you understand these things. So it's important to be prepared, have your trauma first aid kit, take classes, educate yourself, and you have to practice, because you can have all this equipment and if you don't know how to use it, it means nothing. And again, it doesn't substitute for proper training. So, places like Stop the Bleed, they can teach you the basics and you can get more hands-on training with it. American Heart Association, American Red Cross, they have first aid classes. The NAEMT, if you're looking for something a little bit more in depth, they offer TCCC, it's Tactical Combat Casualty Care. They also have a civilian version, TECC, that's Tactical Emergency Casualty Care, and that's a much more hands-on, intense training scenarios that really prepare people for the real situations. So just remember to stay prepared and stay trained. Any questions?
Yeah.
What classes have you taken?
I've taken all of them, except I haven't taken Stop the Bleed. I've taken TECC, TCCC. They're all pretty intense, and it's good training to have.
Adriana, Stad, couple questions. What is a sucking chest wound?
So attention pneumothorax, there's several different types. There's attention pneumothorax, there's a pneumothorax, there's a pneumothorax. Basically what happens is when, say you had, we'll just go with a gunshot wound because that's typically what it is, and it penetrates the lung. Your lung is like a balloon, and if you put a hole in that balloon, it's not going to expand fully. It's also going to allow air to get trapped in there that's not supposed to be in there, and you'll start to realize that the patient or the victim can't breathe properly, and that's a life-threatening condition. So that's something that you want to take care of, and there's further procedures that can be done that you can't do unless you're a trained like paramedic, nurse, doctor, something like that. They have special needles they can put in there to decompress it so they're able to breathe appropriately. And then later they can put in chest tubes and stuff like that in surgery or before surgery.
Thank you. I was informed that I only had one question, so Mom has a question.
So most people probably don't have like the kits that you have there.
Mhm.
So what is something that you could use in place of like an actual tourniquet that would stop the bleed?
So I always recommend I recommend wearing a belt anywhere you go, because a belt is always it can always be improvised as a tourniquet. It can be improvised as, say you're in a situation you have to move somebody really quick, you could wrap it around them and like pull them out really quick. There's a lot of different uses for, just something as simple as a belt, and you can find a stick, you can find something like that as a windlass.
Awesome, thank you.
Don't use shoelaces. Don't use.
How long can you have like a tourniquet on?
How long? So studies have shown that they do cause damage over time. I don't know the exact amount of time, but you as a first responder, even me as an EMT or any of us in the field, we're going to get them to the next level of care that will be able to get them in surgery and get that tourniquet off before it will start causing things such as nerve damage, even loss of limb. So the most important thing is to stop that bleeding and not worry about the damage that a tourniquet might cause.
Awesome, thank you.
Thanks for letting us participate.
Thank you.
Yeah.
Thank you.